And for those of you that don't know me, my name is Dr. Scott Fraser, the founder of Fraser's, and
this is Dr. Thomas Kelly.
Yep.
I'm also one of the co-founders, I guess, and I'm working at the Alfred at the moment, so I'll have a chat to you guys about what it's like on the front lines, and
So we decided we'd do this webinar because there's a lot of people reaching out to us asking about really what's going to go on.
Mm-hmm.
It's uncertain times, as someone sort of mentioned before. We haven't seen a cancellation of a GAMSAT, at least to the best of my knowledge, before.
No.
So for that announcement to come is of course quite jarring. A lot of you have been studying, you've been preparing, and it's sort of hard to know when you get that sort of an email, especially one that doesn't forecast exactly what's going to happen next, what to do. So we're going to discuss that. We're going to look at some of the different options, look at some of the information that's out there as to what will be the likely outcomes, we think, and that will help us sort of navigate a path forward. So we'll cover a little bit about the virus. So Tom's working in the hospitals at the moment in trauma, so he's getting sick firsthand. Then we'll talk a little bit about GAMSAT 2020 and be it the potential reschedule or whether it's actually cancelled and what that means. And then I think the other thing that we need to consider within all of this is how that affects applications for 2021 intake. So we'll discuss that as well to give you guys a full picture. So this isn't just about the GAMSAT. This is hopefully going to answer your questions end to end, and you can feel a bit more confident about what will happen in 2021, pending ACER finally releasing their decision on the 23rd. So I guess maybe that's something I should say at the start. This is a caveat. We are not speaking for ACER. We don't represent ACER. There's no affiliation with ACER. They will, on the 23rd, at that point, make a decision as per their communication to you guys as students. So what we are doing and what we are saying is not ironclad, but hopefully it gives you some confidence about the path going forward.
I guess it may or may not age well. We'll have to wait and see.
But
I guess we've been doing this for you more than a decade, for me more than 5 years. So I feel like we have a pretty good handle on how these types of situations could play out and what that will do for your scores and interviews and everything that comes next. So we'll do our best. All right, let's keep going. So this is my bit. So I know every day everyone's getting more information, and so I don't want this to be too much of a monologue because you're probably more interested in how Corona is going to affect your applications. But if you guys do have specific questions that you want to ask a doctor, or I guess that's me nowadays, you can just ask. I guess my 2 cents is that some of the there's been a little bit of misinformation especially on social media about this just being cold and not being something that we have to worry about. And I think there's been a pretty significant campaign. Most of you guys would have seen stuff about flattening the curve in the last few days, which is really good. And a lot of that information has been pretty good. Again, I'm in my social media bubble, so I don't know what everyone else sees, but from what I've been seeing about social distancing, cancelling big gatherings, good hand hygiene, those types of things will reduce the sort of exponential rate at which the number of cases increase. And those measures will help the hospital system manage the number of new cases that are occurring over time, which is really good. At the moment at the hospital, I obviously don't speak for the hospital, I'm just one doctor there, but my personal experience has been that there are some changes taking place. So we're reducing the number of big meetings we have with all of the healthcare professionals in one place. That's a protective measure for the workforce, so that if there is or is a situation where someone is infected, we don't have to isolate half the hospital and lose most of the workforce. So where we had meetings of 10, we might have meetings with 2 or 3. We're obviously taking all the necessary precautions with PPE and other things. And I think we're slowly seeing, as you guys know, there's 300 cases reported today, and only a couple of days ago it was 200. So we're still roughly on the Italy, US, most other country trajectory, unfortunately. And I think that's why we're seeing some of the public health measures escalating kind of literally on a daily basis, because we're not seeing the flattening that is expected. That being said, these types of measures are kind of on a macroscopic scale. So some of the spread has actually been sort of set in train. So these things that we're doing to flatten the curve will only be seen in the next couple of weeks. But it is possible that the government does a full lockdown and closes all unnecessary businesses and that kind of thing in the next few weeks, because they might not see the flattening that they're expecting. Whereas if you look at places like Singapore or Hong Kong, Japan, places that have been preparing for this type of event ever since SARS, and they've had a myriad of other respiratory illnesses in the past, they took these strict quarantining measures and hyper testing really seriously, really quickly. And that's why their flattening happened a lot earlier than we're seeing in other Western, more developed countries. But I guess regardless, the idea of all of this is to reduce the peak number of cases. There's also a bit of misinformation about like the area under the curve being the same. Oops, there we go. So a lot of these graphs you'll see, it looks like the area under the curve is identical. It's actually not the case. So
there's a widening, isn't there?
Yeah, like there's a widening, but there actually would be less total infections as well. So there's a flattening, and also it'll reduce the total number of cases, because when you flatten the curve, you also increase the number of recovered people. So there's actually like multiple variables that are happening, but just to explain in a simple way, basically just to slow down the rate of cases. Does anyone have any specific questions they want answered? It's okay, so I'll wait for them to come in. But I guess from my perspective, I guess this is a classic problem of absolute versus relative risk. So on a relative risk basis, sure, this might be as bad as, like, we don't know exactly how bad, but it might be as bad as, you know, swine flu, or maybe even just like a normal flu on a case fatality basis. Could be worse, could be a little bit better. It's still being decided. But in a relative sense, that's not much. But you can see in the peak of the curve, if that's 100,000 new cases, even if it is 0.5%, that's still going to be 500 people that need intensive care. And in a country the size of Australia, those intensive care beds will quickly be filled up. So I think in the US, they were saying they have something like 13,000 ventilators for patients, and they're projecting something like a need of 25,000 to 50,000 in the worst case. And so this flattening means that we can have people on the ventilators over time, so that we can still treat the total caseload, but over time. And it's hard for people to understand that even at a small relative risk, the absolute numbers will just overwhelm the public health system. So that's what the main, I guess, issue is. Anyone have any questions before we move on? And the one thing I would say is that, so for my family and friends, I am recommending like basically no unnecessary social contact. So things like public transport and other things, although I think the government avoids suggesting these things to avoid a state of panic. But in general, like if you have a job or you're in a situation where you don't have to be in contact with others, I would avoid it. It's just the sensible thing to do at the moment. Yeah.
And I guess why we're telling you guys this is because these are the things that ASA is being asked to consider when they say that they want to put on a gathering of, in some places, 2,000 plus candidates. Yeah. So part of this is having a little bit of empathy for the equation that ASA are having to balance in their minds about whether they sort of, find a way to put this on. And so understanding it from a health professional is really critical. While we're all quite emotionally charged about how that affects our ability to sit the exam and our candidacy and our access to 2021 entry pathways, we still need to be considerate of the civic and social contract that exists between ASA and the greater population and us as citizens as well. So, yeah. Is that a question?
And I guess, so there are a couple of questions. So I think a couple of variables that will actually impact when the GAMSAT will happen, and something that just out of interest, say you guys should be watching. So China have peaked and the number of their new cases has dropped significantly. Their public health measures have been more drastic than pretty much anywhere else. But I think that the thing that is interesting and worth considering for you guys is they're slowly starting to reduce those restrictions and starting to go back to work. And for like the CDC and a couple of epidemiologists think that they're going to see like a really quick second wave, like another exponential growth in the number of cases when this happens. So I guess there are two outcomes. If they go back to work and it fizzles out and coronavirus number of cases is basically negligible here on out, that's really good news for everyone, because it means that these interventions will like meaningfully change the trajectory like forever. Whereas if it only works for a temporary amount of time, so if you shut down society, yes, it slows the rate of infection, but it only works while everyone is shut down, and then as soon as you go back to normal, it goes exponential again. That will be a very difficult situation, because then it becomes a long-term play. So we need to flatten this curve for maybe a year to survive this from a healthcare perspective. And that would be a situation where maybe the GAMSAT's completely cancelled, because we can't actually remove these like self-isolation measures indefinitely. So I'm watching carefully to see the number of new cases that are happening in Wuhan and information that's coming out of China there, both for the well-being of everyone and also out of interest sake for GAMSAT and everything, just for the world, really.
There's a lot to be learned from that.
Yeah, okay, answering a couple of questions. So what are your predictions, thoughts for closure of universities and schools? How will this affect transmission? Yeah, so I think the non-closure of universities and schools, I do think eventually it will happen. There's obviously a balance to be had between these measures and the impact they have on the society. For instance, and there's I think it was on the Joe Rogan podcast, the guy that just spoke about closing schools and then what parents have to do. So all the parents have to go home. And like the kids are least affected by this virus. So you might have a bunch of subclinical cases that haven't been tested that are actually in the school population. Like we're seeing every day more schools saying they have positive cases. So then you suddenly send all the school kids home, infect the parents, then you lose a lot of the workforce. So actually it's maybe not the most sensible thing to close universities and schools. It is sensible to change the way teaching happens at universities and schools, I think.
Definitely.
Yeah.
The universities have to pivot. They've been being asked to pivot for a long time. And I think universities and schools are different. So,
and that's this question. Yeah, should we go to uni online? Yeah,
I think you should stand up and say, no, I'm not going. I'm going online.
Yeah.
You've got the online resources. You shouldn't be penalised for that, and you should be feeling confident to write very confidently to your faculty or whoever your representative is that you're taking this as a precautionary measure, not just for yourself, but for everyone else.
Yeah.
Because that's the other thing. We're fit. We're young.
Yeah.
But in theory, we're not in the high risk category.
Yeah.
That makes us vectors for high risk people. So we need to think of ourselves secondarily like that. And if you can study online, this is why unis should be shut down.
Yeah.
Also, most people at uni shouldn't be affecting their parents' ability to go to work.
Yeah.
I mean, not to be judgmental, but most of you should be independent by now. Most of you should be able to be self-sufficient by this point. So the uni-school equation is actually quite different. And I fully expect by next week, because I've heard quite a lot of whispers from faculty friends and whatnot, that all universities will shut down next week.
Yeah.
So that's one, because of what online learning is progressing in that space, we can expect that.
Yeah. So we answered that question. So yes, you should watch your lectures online.
Yeah.
Thoughts on school closure at the current level, given childcare, what point is determined? Okay, so small aside. So the reason China's interventions were so successful is because they actually separated people that were infected from everyone else. So our model at the moment is to self-isolate, which actually doesn't really fix the problem, because, for instance, if I was to get sick and I went home and my wife's at home and she gets sick, she won't have symptoms for 3 days. Now, the current imposition is that she could actually go to work for the next 3 days, which is still spreading the virus just as exponentially as it was before. It's just that I'm suddenly at home sick, where I probably would have otherwise been anyway, given any other cold or flu. So that type of self-isolation, it kind of works to minimize the rate of spread, but it doesn't stop spread. China took people that were infected, separated them from their family, and sent them to places where only infected people were, these specific corona hospitals, and that's why it was so successful. So all of these measures are going to slow the rate of spread, but there's still going to be a lot of spread. That's my personal perspective. I think that sort of answers that.
Okay, so I think
masks are not that effective because no one wears them correctly. The only ones that actually work are N95 masks, and they're in really short supply, and even those healthcare workers can barely put on correctly. So masks are okay for droplet, but ultimately not that useful. What would be your thoughts then on university placements in healthcare settings? Okay, this is a really good question.
It's a good question.
So healthcare placements. So I know most of the med students have been sent home effectively in like at the Alfred, but also like our own tutors as well, like the University of Sydney and a couple other places. I think it's sensible because there's no reason to expose people to such high risk when they're not, unfortunately, ultimately like adding to the healthcare workforce. If we had med students, which we should, doing like these fever clinic consults and helping people being pushed through clinics, then it would actually be useful to have them. But unfortunately, the way medical school is going, there's less and less of that. So given that they're not necessarily going to be helping the workforce and a significant risk period, just doesn't make that much sense to have them around. But I do hope that hopefully we have China tail off and we can get them back in hospitals very soon.
Yeah.
Yeah.
They're really on Facebook.
Yeah, I'm just having a look. So one was about sitting GAMSAT in Singapore. Any idea when GAMSAT will be rescheduled? We'll talk about that. What about practicals and tutorials and uni lectures online? Yeah, so like I'm actually after this going to a practical for the surgical anatomy of diploma, and I really don't want to go, but like there's no other option at the moment.
Yeah. I mean, if you look at some of the online learning models, there's some really good universities that went online first, like Charles Sturt University. Shout out to Charles Sturt. They basically do their tutorial / practicals in an intensive block. So you do everything online, even some of the shoots PBL based stuff for quite an extent. And then you go to Wagga Wagga or wherever the campus is, and it could be for a week, and you just smash out pracs. So I also don't see a reason why universities can't pivot to that. Like you don't need to know how to pipette now versus at the end of semester. Either way, you're not going to be a scientist for 3 years, 2 years, and not using a pipette. So like, how critical is the practical right now versus what you need to do? I really do think like you guys should be thinking about what's going to happen in your holidays. Like it's highly likely you're going to lose your holidays if they readjust these semesters and whatnot,
change it,
and actually say, right, well, now you're all coming in for 2 weeks of intensive pracs, followed by intensive examinations. That's a possible outcome, and it's consistent with other learning models that we see.
And I guess at some point, like, so obviously there's a separation between what the universities are currently doing versus what the government's going to force everyone to do in a short period of time. So I guess obviously at the moment, make your own decisions about what risk you're willing to take. But at some point, I do think there'll be like a national policy that, you know, universities and schools will shut for some period of time. Okay. I'm guessing it would be hard for ACE to reschedule since the exact trajectory of the pandemic itself and also what the government actions will be is undecided, I guess. Yes, that is correct. So even though everyone is waiting for March 23rd, and I'm sure they're considering a lot of these things in the decisions they make, it would still be like, I would take it with a grain of salt, whatever plan they make. They'll try and make something as definitive as possible, but there's still obviously a chance that even that would change.
Knowing some of the people in ASA though, and like very high up, and I mean, when I say knowing them, I don't mean I know them. I mean, I know of them, I know of their caliber, and I know of their type of principles and their standards. They will, part of the reason why they're delaying this till this time is to collect, get information. ACE is actually really good at modeling things. So I'm sure they're trying to be involved in the modeling, understand the models, to be able to project as best as they possibly can. So whatever conclusion they make, they will make it not lightly at all. It'll be very well founded and very well based. So if they do cancel it, it's because they're projecting that this is going to continue on and on and on. If they reschedule, it's because they believe that we're going to put measures in place or
find a way around it.
So no doubt they're watching things like Wuhan and whatnot as well, try and get that information.
All right, and just to tie off the corona specific stuff, we also had a question online that was about, you know, like where would you find information about how China is tracking? So I'm talking on the scale of like weeks. So on a weekly timeline, like by the end of next week, say, on all of the different case trackers that are, there's a bunch of them actually. Some are from WHO, others are a bit dodgy, but you should see the case curve for trying to sort of like curve off like that and go back to nothing. But yeah, in terms of specific resources like CDC, WHO, even New York Times is doing some amazing infographics at the moment.
Johns Hopkins University, there's a group there that are trying to understand the model, and they're trying to provide up-to-date live models. And they did, I think they've got a link with the Lancet to try and make sure that the Lancet's up to date.
That's cool. Yeah. So there are a bunch of resources. Just go to reputable places. I wouldn't go to like Daily Mail or something.
Sydney Morning Herald.
Just by those headlines. Those headlines are very clickable.
That's the point. So hopefully that gives you guys a bit of understanding as to the factors that are affecting Corona. And in turn, that should help us understand how ACE is going to make a decision. So they're going to consider the safety of their staff. They're going to consider the safety of you all as candidates and wanting to ensure that you don't have any adverse health outcomes, or that can be minimized as much as is humanly possible. They're also going to be considering the range of different contingencies. ACE is not sitting on their hands right now, twiddling their thumbs, and I can assure you they haven't been for some time. So they cancelled Singapore and Beijing, Abu Dhabi, and all the sort of small testing centres outside of sort of London, Melbourne, or London, Australia, and the US quite early on. And at that point, they would have been thinking, right, how does this go? How does this play out? And yeah, they'll have a range of different contingencies. The possibility of those coming into play, of course, would have varying levels of probability depending on how things play out. And it is an evolving situation at the moment in Australia. So from my perspective, at least, disruption is better than cancellation. So hopefully they come up with a contingency that allows for a reset. And yes, it's been an arduous situation to have to go through to, I'm sure for a lot of us, be prepping to some extent, or at least gearing ourselves up emotionally to sit the GAMSAT and then have it quite abruptly taken away. But at least if there is a disruption and they do adjust the dates, there will be no major effects to the 2021 intake. If they cancel it, then the 2021 intake will be an interesting intake, that's for sure. Yeah.
Next slide.
So these are the different people that ACE are working with. I think the big stakeholder in this is GEMSAS, who is the intermediary that works with a lot of the Australian universities. It'll be GEM in the UK that works with the UK universities. So they will be considering very strongly how to make sure all of the stakeholder opinions are balanced. I'm sure all of the universities have different perspectives and thoughts on that. The other thing is there's the unis outside of GEMSAS, so Monash, Flinders, Bond to an extent, that will not be using GEMSAS to take in their applicants. With that said, a lot of those universities have alternate pathways already. So they have their own guaranteed entry pathways, or they have quotas to be allocated outside of the GAMSAT consortia. So they could flip their models slightly if they absolutely needed to. The other thing is they need to be fair. So someone mentioned this in one of their questions earlier. Fair doesn't mean that we like it. Being a parent, this is something you always have to explain. Just because it's fair doesn't mean that it's fun. So if you cancel it for everyone, you affect everyone equally. And, that's an unfortunate outcome for sure, but it will be equal across the board. Rather than necessarily saying, okay, well, we'll run it in Perth. Perth's managing Corona really well out of the Australian cities. Perth goes ahead, everyone else on the eastern seaboard and in the central, bad luck.
It's not going to happen.
They've got to work within the constraints. So whatever they announce, my belief is that will be somewhat of a final announcement, unless, of course, something really, really
something
bad
else
happens.
Catastrophic happens.
But like I said, ACE are really good at modelling. They're really good at maths. And so I'm sure they're modelling this.
Yeah, makes sense. Also, I know I saw some people putting up their hands on Zoom, which is very nice functionality. But if you have questions, just chuck them in the Q&A, please, or comment on Facebook, depending on where you're watching.
Yeah. So if there's cancellation of the GAMSAT, basically what happens is the universities can choose to go ahead with a 2021 intake. If they do, then they pick from the same bell curve of people that they have. The only difference now is you're taking from 3 exam pools instead of 4. So you'll be taking from March 2019, September 2019, and September 2018. The other thing to consider is out of those pools, a lot of people have already used their scores and are in medicine. So the way I look at it is, if you're looking at this bell curve, look at that sort of area above the sort of 1.5.
Yeah. Trying to draw on it, guys. So I'll get there.
1.5 sort of standard deviation, which is normally scores above 70. So if you're above 70, you're probably in either you got into 2019 med, or you're in the 2020 med cohort. What that means is then they'll be selecting students from a pool of scores that are lower, assuming that all of those higher scores are through to medicine now. Obviously, that means the entry scores for medicine in that particular year will be lower. They simply have to be. The universities, I believe, will make a very binary call whether they abide by it or whether they don't.
Yeah.
So some universities may say, look, well, then we're just going to take our internal cohort and we're not going to have GAMSAT students, or they'll change the ratio or something like that. But nonetheless, there will be lower GAMSAT scores to get into the universities.
And I think just to like reiterate, so just to make sure, and if you don't understand this point, just comment now. But I think it's important to understand. So, small pool, the students with the best scores will have been already taken out effectively because they would have gone into medicine for this year. And now we've got a couple of questions coming in. That's good. So it's just a simple supply and demand thing, right? You just have a smaller group of students, and some of the students with the highest scores have been preferentially removed from that pool. So you're just going to have a group of lower scores applying. This is assuming a cancellation where everyone gets to apply with their existing scores, and no one who hasn't sat a GAMSAT is able to apply.
Yeah. So if they cancel, I think the reality is if you haven't sat the GAMSAT, unfortunately, you are unlucky. They're not going to allow you to just use your GPA or something like that. It's more likely they'll still want some sort of a hurdle. That means people with old scores, you can still use them. But maybe as an example, as a hypothetical, maybe you had an old score of 64 and you were like, I can't really apply to Melbourne Uni with that.
It's just off,
Now, given that the 70s and whatnot are out of the pool.
Yeah, you're probably in the right range.
You're probably in the right range.
Yeah.
Yeah.
So I guess like a generic, where does my score need to be? Given a cancellation, we would say, I don't know, mid to high 60s is probably now a relatively competitive score. Obviously, some of this is subject, see what happens. But definitely, the bottom line would be definitely apply, even if you feel like your score isn't good enough. Maybe just to quickly answer a couple of topical questions. Do you think they may open it up so we can use past years' scores as well?
Yeah. In short, no.
Yeah, I don't think so.
I don't think they're going to extend backwards because where this is most unfair is to people that are registered for this year that now won't have access.
Yeah.
So to say to students that have sat it multiple times, you also get to use further scores, actually doesn't.
Yeah, you're kind of like not really solving a problem that exists. Yeah. I guess it's possible, but don't think so.
I don't think so.
Yeah. What happens if you've never sat the GAMSAT and want to apply? Yeah, I mean, so that's the whole point of this conversation, and we'll do some more counselling focused stuff towards the end, but it's obviously extremely disappointing, and I'm sorry if you're in that situation. I guess, there will be more opportunities to sit the GAMSAT. All of the work that you've done, we'll talk about a little bit later, how that will still translate into future SIDs. But ultimately, if they cancel and you haven't sat the GAMSAT, pending some crazy changes in the way they take applicants, it's pretty likely that you'll just have to wait or do something else with your next year and apply when you can sit a GAMSAT.
Yeah. So will they look at GPA instead? Look, I really don't think they will. The universities, unless you're on like a preferred pathway, like you're already on one of those guaranteed entry minimum requirement pathways,
Yeah.
I don't see them all of a sudden going, right, well, because there's no GAMSAT this year, we'll ignore the GAMSAT.
Yeah, this question is a little different actually. It's about, will you get provisional offers based on GPAs?
That's
Yeah.
to come.
Yeah, we'll talk about that.
Yeah. There is a world where that could occur.
Do you think competitive 50s with a high GPA? Look, I still think 50s is getting too close to the middle of the curve. 10,000 people sit and middle is usually 56, 57, 58.
Yeah.
So I'm not saying anything bad about anyone who has those scores, but it's just a numbers game, right? If there are 5,000 per sit that have that score, even with a high GPA, you could be competitive, but I don't think it's that likely. But I would still apply.
But you're more competitive than what you would be.
Yeah, exactly. Yeah, your chances have improved.
Yeah.
Do you reckon they'll shift the weightings for entry? We'll talk about that later.
Yeah.
Okay, let's keep moving. Yeah.
So that's outcome one, right? So that's if they continue with the cancellation, as kind of discussed. Though with that said, it's also something that we can only know for sure on the 23rd.
Yeah.
Another option is rescheduling, and there's many ways you could reschedule. Obviously, we have a ban on gatherings above 500 at the moment.
Yep.
You could divide the GAMSAT up into 20 different locations of 100
Smaller
people,
venues, yeah.
or what have you. That's definitely possible. You could do it over multiple days. Like they won't want to do that, but like it could happen. So
like there are whole buildings that do this proctoring sitting where they that's the only thing they do is sit these types of exams over like multiple floors. It's definitely possible.
There's one of them down in Queen Street. I did one the other day.
Yeah.
And it's just lots of different meeting rooms on all the different levels. So you could totally do that.
Yeah.
And so that way they would meet the health and risk requirements and still be able to push ahead. Another thing to consider though is some interesting updates that occurred on the University of Western Australia website, where they mentioned that it was postponed in Singapore to the 6th of June. Now, of course, as Tom alluded to, Singapore is managing the outbreak really, really well based on their previous learnings from SARS and some of the other epidemics that went through there. So it stands to reason that Singapore absolutely will be ready by 6th of June.
Yeah.
Singapore traditionally has a very small sitting group, but nonetheless, they were cancelled first, and they're now being reinstated. The other thing that we know about ASA is they don't tend to do multiple dates. So it's interesting that the 6th of June is a date. A lot of the whisperings I heard were around late May, early June. So this kind of confirms if there was going to be a reschedule, this was the time.
Yeah.
And that would mean if they reschedule it here in Australia, this will be the time.
Like if we had $100 to bet, 98 would be on the 6th of June.
Categorically.
Yeah.
So that would be a good thing. It gives us an alternate timeline. It does have implications on what we're going to do for applications for 2021.
Yeah.
And we'll talk about that in coming slides. But if you're a person that doesn't have a GAMSAT score, I think this is what you want, is for this reschedule to occur. And so hopefully that means you will lobby all your relative universities and whatnot and councils get their act together, get people isolating, get that curve back on the downward.
Yeah.
So come June 6, a combination of multiple venues and the fact that we're seeing a solid management plan nationally of the spread would mean that ASA would feel confident to be able to allow the exam to go ahead. And
we had some pretty good questions in our internal kind of student version of this webinar. Was like, what if I had corona and on the date that I was meant to resit the exam? There are all sorts of contingencies that we can't answer, but I thought that was just an interesting one just to get you in the headspace of ASA. So, as you delay these dates to later and later points, you're actually going to have an increasing likelihood that the students are going to have the virus. So it's just a challenging situation for everyone, because at some point, and this happens in all outbreaks, you do actually have to kind of withdraw some of the social distancing and all the things, because sort of like the UK, you get to this point where it's sort of pointless, I guess, because of just the volume of virus in the community.
Yeah.
Once you pass the peak of that curve. So I guess the game would be, if suddenly we beat this exponential curve, cases disappear, then it might be safe to reset. But anyway, June 6th. Maybe we'll just quickly have a quick look for some questions about this Singapore idea.
Yeah.
All right. Possibility of online GAMSAT or GAMSAT alternatives by unis.
Highly doubt that would be something ACE would be trying to avoid, because I think that would be, like I said with the UMAT, that would be the end of the GAMSAT.
Yeah, I mean, online is like a real outside chance. I guess it's possible, but just like the format of the exam is so hard to do online.
ACE would rather spend money on multiple venues.
Yeah, and GAMSAT alternative by unis, I think the timeline is too short.
Yeah, that too.
Yeah.
Despite what people think, ACE spend a lot of money curating this test.
Yeah.
So it's
and again, that would be a health and safety risk anyway, because then the universities would all have to run like thousands of students in each uni separately. So I don't think that's fixing much. If the GAMSAT is cancelled, will they force applicants to use their results from previous years or be unable to apply? We sort of mentioned this. We think unable to apply, unfortunately, unless you have valid results.
Yep.
Do you think it is going to be viable for some universities to completely exclude the GAMSAT in their entry pool?
I think only the portfolio unis could potentially do that, and then there would be a massive weighting on your interviews.
Yeah, it is possible that there's some shifting and weighting, but it's not that likely.
Yeah, no.
Do you reckon they'll shift weightings? We just spoke about that. I don't think so. Just looking at some of the new ones. If they were to reschedule, would the new test date be within a month from now, or more likely be in June?
Categorically, ACE won't do multiple dates.
Yeah.
So this June 6th leak for Singapore, that'll be the date they're targeting for Australia.
Yeah.
Sure.
Won't not allowing students to apply for 2021 mean a shortage of doctors? There's not a shortage of doctors. It's the opposite. There's way too many doctors.
Yeah.
Maybe Corona should be, as long as it didn't kill people each year, it'd be good. Good for my career prospects. I've been applying for jobs interstate. If I move interstate between now and then, do you think I would be able to change my test location?
Yes.
Yes, I think that would be very
ACE is going to be very reasonable and flexible during this time, because it's been a pretty massive disruption.
Yeah.
So if you say, look, I've moved, they're going to let you sit.
I think so, yeah. What GPA would be competitive? Okay, so I want to just put a blanket statement on GPA and GAMSAT questions. This is not a promo, but you should use our preferencing machine. It's based on something like a quarter of the cohort that applied last year, all of their GAMSATs and GPAs.
Yeah.
If you just reduce the scores on both GAMSAT and GPA by 5 to 10%, that's roughly where we expect the cutoffs to be.
Yeah.
So where Melbourne Uni might have been a 6.8 GPA and a GAMSAT of 66, 67 plus, you have to get both of those or above. We might be seeing roughly 5 to 10% lower on both GAMSAT and GPA for a successful entrant.
Yeah.
It's hard to know exactly where those limits lie, but you have to play around with it yourself. Assume a quarter of the cohort plus all the highest scoring students are all disappeared. What would you expect the change to be? Because that's what we're doing. That's just our best guess. And I think there are some similar things. What are hypothetical cutoffs? Like we said, mid to high 60s, especially the mids, like 63, 64, 65 may be more competitive than previous. A couple of things. So if anything, any dates that are currently mentioned on the GEBSAS website, just assume they're no longer relevant. There are dates that say 31st of May, like applications after 31st of May won't be considered. We'll talk a bit about that in a second, but everything is subject to change at the moment.
Yeah, someone's asked if the situation's dire in other countries, would that affect Australia? Australia is the biggest test population. So like I said, they cancelled Singapore and Beijing long before they were even talking about rescheduling Australia or cancelling Australia. And that's because the test centre is a very small centre. So small centres will get axed quite happily, but you're looking at 80 to 90% of people sitting it for March, at least in Australia.
I think we've covered a lot of these. So, universities that needed 70 plus, they actually don't exist. If you use the calculator, you'll see that they're actually 67, 68 plus.
Yep.
So that might be 64 or 65 now this year.
Correct.
Wouldn't a reset in June be worse for Australia since it will be flu season?
No, I mean we have the September sitting anyway, and we don't base our sittings based on usually the likelihood of catching a cold.
No.
So there's no correlation between flu season.
Yeah, and you will see you will see a lot of the stuff like get your flu shot because as a way to prevent corona. It's a little confusing. I think they're mixing their public health campaigns just to increase the rate of flu shots. And yes, sure, at a stretch, I guess it's possible that someone could be infected with influenza and get corona, especially in sort of susceptible groups.
Yeah.
So But I don't think that will play into whether or not they do a reset.
I think we're ready for the next slide.
Yeah, let's do it.
So a lot of the questions now are around like what happens next.
What do I do?
So firstly, we can't say whether there's going to be a reschedule or a cancellation definitively. No. We're just sort of taking you through the likely thought process of ASA, what the information thus far is kind of alluding to. But ASA has specifically set that March 23rd deadline because they want time until then. They want to look at all factors until then. And until then, you can't know. So for those of you that are feeling a bit anxious, feeling a bit uncertain, actually just take this time to recharge, reflect, get all other aspects of your life kind of in line and organized and sorted. There is literally nothing you can do for GAMSAT right now. So you're much better spending your energy, spending your stress positively towards other things that maybe you'd also let kind of go while you're focusing on GAMSAT.
Speak to your family. Don't see them because that'll but speak to them.
Speak to them.
Yeah.
Maybe through video. And you can, take care of you plan all your uni stuff out, maybe plan your work stuff out, and just get a handle on everything, get grounded again. Because really spending all this time like what ifing about the future, it's not good for your health. You're much better focused on resting and really just trying to take advantage of this downtime. And when March 23rd comes, dealing with it then at that particular point. But at least hopefully now not having a rough idea of what could happen, you're not going to get surprised by anything. I used to say, new test center, the moon. And everyone has to book Virgin Galactic flights.
Call Elon Musk, yeah.
So that's the sort of the takeaway there.
Yeah.
So a lot of questions are coming in about interviews, and that's understandable because a lot of us Aussies don't understand how interviews work elsewhere. But in the UK, actually, what happens is you apply first, and then your GAMSAT score comes out. So you kind of provisionally and conditionally apply in the hope that your GAMSAT score will be good. And you also get provisional offers that you're going to get an interview pending your GAMSAT score. So getting a first sort of provisional offer in the UK literally means nothing because your GAMSAT could be rubbish and they'll just, you won't follow through with that. At the same time though, if you get your provisional offer and then you get your GAMSAT score, you know that you're going to actually get your interview offer.
Yeah.
So it is more than likely, and as well, the leak on the UWA website alluded to, application dates and processes are going to stay the same. So GEMSAS portal will open up as per it normally does, which is what sort of
early May.
Early May. It'll stay open and applications will close end of May, which is when they normally do.
Yep.
And you'll need to get all of your supporting documentation, etc., ready by then. So you should be, obviously that's going to clash if they reschedule the GAMSAT, but there's definitely ways you can manage that. So don't think that it's going to be a massive detractor. Equally, the one thing I would say from an implication standpoint is for people that were kind of thinking about hedging their bets as to which preference of the unis they're going to put, you now just simply need to be honest. Like, where do you want to go? What's your number one priority? What's your number 8 priority?
Yeah.
Put them in order, and the GAMSAT score, put your best foot forward on the day, and the score will come out as it is, and hopefully then it all marries and matches.
Yeah. So I guess what we're saying to summarize is that there's possibility that you'll have interviews that are provisional based on GAMSAT scores. That's if it's delayed.
Yep.
If it's cancelled, you might just have to apply with the existing GAMSAT score pool. And for those that don't have one, you'll just miss out until the following year. And because of shortened timelines and possible date changes, there may be an actual change in the model of the interviews themselves. So there may not be university-specific interviews, and there's like a lot of unknowns, I guess, in this space.
Yeah.
But yeah, I guess the bottom line is you should still be preparing for applications the same as you otherwise would. And we'll have future webinars to talk about how to navigate whatever timelines are delivered to everyone.
Correct.
We're waiting as much as you guys are. Does ASA offer what? They keep sending me emails. Is it a scam? If you're getting lots of emails from ASA, it probably is a scam.
Yeah, that's probably not real ASA.
Do you think there will be an effect on med entry beyond 2021?
Only in the competitiveness of the next round. Assuming that everyone, because what ASA will probably do if they do cancel is they'll allow everyone to defer their candidature to September
or the following
2020 or March 2021 at no extra cost. but that means everyone's a lot more prepared. There's probably a lot more people gunning for the same ones. So like it doesn't affect entry. The same number of people will get into medicine. But it affects the competitiveness of the exam.
It's kind of like the economy, right? Like everyone's freaking out that this is going to, you see the stock market going down, but there's always a recovery for these types of events. So like however many students weren't able to sit the GAMSAT will then be added to the subsequent pool. So now you have, 2,500 people where there might have been 2,000 in the previous sit. Same way as toilet paper, eventually people will stop buying toilet paper. There's still everyone needs to use a certain amount of toilet paper at a time. Everyone's hoarding it. But then eventually, once things go back to normal, you'll have extra toilet paper.
Yeah. Or you could just
or you're just burning it because you're anarchic. Yeah. Toilet paper is the new currency.
That's a pretty solid question. So what would happen if you apply with an incoming score? So with the GEM applications, they basically take your best score. So I think that's what would have to happen here. And I'm sure ACE are probably communicating with GEM now about, and GEMSAT are as well, about how that can be streamlined. We've dealt with that.
This is a very difficult question. If I'm equally torn apart by two unis, so romantic, how would I list my preferences? Would I consider the uni with the lower cutoffs? Look, like we'll talk about preferencing in detail in our application workshops that will happen in the next few months. But in general, I would just say preference in the order of where you want to go. The system works such that it's very unlikely that you'd be disadvantaged by that.
Yeah. So will this affect cohorts, cohort size? We can't really answer that. I would personally suggest no. I think
the unis are in it for money. Like, let's be honest.
You said that, not me, but I'm not going to counter that. The unis are going to find ways to fill their cohort or just cancel their cohort. So I don't think they're just going to all of a sudden take 20 students instead. I think we've covered that around scores. Could they look at UMATs? Well, firstly, the UMAT doesn't exist anymore. It's now the UCAT. Have a look at our UCAT website if you would like some info around that. We have a free UCAT course. And yes, there are a series of UCAT universities. And the UCAT is very different. There's kind of a maximum of 20 people within a room. So I don't see any issues around
It'll definitely go ahead, I think.
That, the other thing is they'll be in and out. Yes, people are touching surfaces because it's an online test, but I imagine part of the UCAS are probably some of the people that are hoarding the hand sanitizer just for the UCAT.
And I would just say that I guess the underlying sentiment of this question is, will they do UCAT or UMAT instead of GAMSAT? I don't think that's the case.
I think so.
No. Is it a reschedule or cancel more likely overall? Okay, this is completely opinions. I think it's going to be cancelled.
You think it's going to be cancelled?
Yeah.
That makes sense. That's a medical opinion. I think it's going to be rescheduled. Two reasons. We've seen the leak now about Singapore, and also they're
you retain hope.
I retain hope on behalf of students. I also think if I was running ASA, if they put me in charge, there's a lot of follow-on implications for what would happen if the GAMSAT got cancelled. Yeah. So I would be doing literally everything in my power to make sure that it goes ahead. But then I think we've established that ASA and I think quite differently.
Yes. I guess it depends how things progress, to be honest. If the doubling rate continues, then by June, every 40 to 70% of Australia would have had it. So I guess it's fine to spin at that point.
The other thing that gives me hope is when they communicated to you guys that they were going to be, responding as required, they should have cancelled before then.
That's true.
If they were actually working solely off medical evidence, we knew this was going to happen right now. They should have just cancelled it sooner, but they didn't. They're holding on to hope as well.
Yeah, and it's possible they put off the date of decision later as well. I know that's horrible for everyone to hear, but it is possible because, again, like I said at the outset, everyone is kind of waiting to see how things progress given the public health measures. And if they see the caseload suddenly go down, sure, they might reschedule. But if they see the caseload keeps increasing, it's very hard to make a commitment of when it would be safe to have 2,000 people in a room. Maybe the safest bet is actually one of these contingency multiple venues type deal. Yeah.
Is postgrad med in the prospectus of Western Sydney? No, because they're a UCAT university. But that doesn't mean you can't be a postgrad person and still access the UCAT pathway.
Is it worth
asking what they're thinking? Yeah, just give them a call. I'm sure they're not getting heaps of calls.
Yeah, just be like, hey man, I'm a bit stuffed. I can't do the GAMSAT, but I really want to get into med school. No, don't do that. They're going to be extremely busy at the moment.
Yeah, they'll be able to see the caseload go down in a week though.
Yes, so that's actually, yes, you can. So if you have a model predicting what the expected caseload is, like we're expecting it to double into every 72 hours. So if it starts slowing down, then you'll see it within a few days. But remembering that people are asymptomatic for 3 days. So you should give any public health measure about a week buffer to see whether or not something would happen, because most of those impacts won't be seen because the first 3 days of spreading has already happened. So let's say by...
That makes your another week's till the announcement it seem probable.
Possible, I think so. When will you hold webinars on medical applications? So usually we hold them
April.
Like towards the end of April into May. Usually we would go into hardcore detail about preferencing and scores and all the kind of stuff you guys are most worried about. But depending on the timelines and changes that get implemented, we'll make the session flexible to discuss a lot of the changes as well.
Yeah. And because I've got quite a bit of experience with the UK system as well, we can talk a little bit about how we think any changes could be occurring that haven't.
This is a good question. So is there a chance Melbourne University extend the guaranteed entry pathways? Don't think so. So usually you would get a full fee place guaranteed for 99 plus. Would they extend that to CSP places or something like that? I don't think so.
No, I don't think so.
No.
All right. So this is a great quote from one of the phrases tutors, Cal. He's probably in hospital now. This is how you should use the rest of your week or until the 23rd. Just focus on the here and now. And hopefully this webinar's helped a little bit. I think we did really well to get through the Q&A then. Any more questions?
We can leave it up. Can we use theoretical June results? I'm sorry, Laura, I don't quite know what that question is. Maybe just clarify in the comments. If they follow the UK GEM model, will you be able to select a previous GAMSAT score? Yes, that's what we said. Yes. So you'll probably apply and they'll take your best score or something automatically. Time for more questions, by the way. If you're watching online, just chuck all your questions in, no matter how weird they are. What do you guys think GAMSAT and GEMSAT will do to accommodate for people who want the 2021 intake but have not sat the GAMSAT or have not obtained a good score? So I think we basically spoke about this at length, right? So we think that there are two different paths. It'll either be cancelled, that's what I think, or it'll be rescheduled, that's what Scott thinks. And depending on that path, you'll either, if you're on my side, the cancellation, you might be a bit out of luck. So you'll have to just wait until following years. If there's a rescheduling, then things will probably progress as normal, but with just some changes in the way that applications work. Do you think that unis may change the weighting criteria? I mean, it's definitely possible. So usually what happens is the universities actually keep their cards quite close to their chest about how everything works. Even sometimes after the application period ends, they change the rules about exactly how they're weighting everything. Yes. Because it's basically their own prerogative, like how they want to do that. But usually by the end of the 31st of May, so the typical cutoff, they'll say, this is how we're weighting everything, mostly because everyone's neurotic and we'll email them a bunch of times. So they'll have an answer to give. I guess we could talk a little bit more about GPA, GAMSAT portfolios a little bit. So my feeling is that given a complete cancellation, I think there's a small 5% outside chance that they just switch to using GPA and a way higher proportion of interviews or something like that.
1%. They're also going to have to interview more people.
Exactly. I guess it's a possibility. I don't think it's likely.
Where it could come in is, let's say so the universities, at least from the people I've been talking to that are in med schools, they don't want to lower the GAMSAT threshold.
Yeah.
Because they're worried about the quality
They
of the
want the best.
candidate.
Yeah.
So if they say, right, we lower this threshold, we increase or we put more emphasis on that threshold.
Like make entry hurdle harder. Yeah.
Maybe even add more stations, and particularly stations that more test for the qualities that are being tested for in the GAMSAT.
Like reasoning and those kind of things. Yeah.
Then that makes sense.
Yeah.
There's a bit of a compensation there. That feeds what you were saying, like there could be some structure change in the interviews.
Yeah, I guess it's possible. The reason I would be, so again, thinking about from the university as a stakeholder, like, you're always using your empathy as your first step. So what would they want? They obviously want the best candidates. They've agreed with ASA and GEMSAS, all these bodies, that the GAMSAT is a test purpose built to find the aptitudes that they've defined as being suited to a pre-medical student that would be a good doctor. That was a long way to say that. And they still want to abide by that. So just because the GAMSAT has been cancelled, they don't want to suddenly change everything about the way they're accepting applicants. They're still going to take it really seriously. So what would you guys expect that change to be? I don't think suddenly making it GPA only is that sensible, because there are many people that have GPAs that aren't 7.0 for various reasons, and it's not a good predictor of who's going to be a good doctor. So yeah, interviews, or accepting a slightly lower GAMSAT scores, those are things that make more sense.
A couple of late questions that were covered. So, if the GAMSATs move to June, what will happen to the applications? They're going to go ahead as normal. So you'll put your applications in first, GAMSAT score will be added second, so you can still get into 2021. So that gets rid of that question. 2022 and future cohorts. No, again, Chris, I don't think they're going to change the cohort size. And they won't take extras to accommodate for that. They have cohort sizes not based on demand. They have cohort sizes based on the outcomes, quality of teaching, the way that they want to deliver the program. I mean, profit does come into it at some point, but I don't think ANU all of a sudden is going to jump from 110 to 220.
No, definitely not.
That kind of breaks the way they deliver their program.
Yeah, they have some upper limits. Yeah. Do you think September GAMSAT will be used for 2021? Probably not.
Probably not.
The timeline just doesn't work. So you have to.
The interviews will have largely been.
Yeah. I mean, like, I know we're saying it'll go ahead as normal, but I do see a world where some of the dates get shifted back. Like, I do think there's a little bit of room in November and December where they usually wouldn't have done it, but it's still quite a tight. Like, it's quite a tight scheme. Like, there are really set in stone dates and everything kind of works back to back to back to back.
Traditionally, the September GAMSAT scores come out around Halloween. So that's end of October.
It's so tight, yeah.
Which means, even assuming you did pre-admission and all of that sort of stuff, the earliest interviews could get going is November.
Yeah. So sort of like in line with undergrad. Like, that's what I mean. I guess it's possible, but it'll be really tight. We'll just have to wait and see.
Termly host GAMSAT, so it's in school. No, the unis can't host it. They're not allowed to, but that would be a way that ASA could do it for sure.
Yeah.
We've kind of discussed that.
Yeah. According to your biblical opinions, which unis do you believe are more generous with their GAMSAT threshold? Which unis are more stringent? Use our preference machine. So you can literally move the GAMSAT on a slider and see which universities go up and down in your chances. It's on our GAMSAT website.
So yeah, look, June 6 does correspond or correlate with the uni exam period. That's unfortunate. So does the September exam, usually with assignments. Like, there's no massive effort made to make GAMSAT not correlate with uni, because the theory there is you're not meant to be studying for GAMSAT. You rock up when you put your best foot forward. So even though we don't, yeah, I think you just go back to that section. It used to be back. So it didn't exist. So like 25 years ago, no.
I think the problem with that as well is that because this is a sudden change, it's unfairly, like, it's unfair how it would affect everyone.
Yeah.
So like, if I've been plotting and planning and studying for GAMSAT and sacrificing my GPA, but I'm actually going to be a great doctor, why would the universities now suddenly change to something that disadvantages me? It doesn't really make that much sense. It makes more sense for them to, like I said, either cancel the GAMSAT or reschedule it in a way that I'm not disadvantaged, or I can still apply in following years without being disadvantaged.
I'm assuming the person that asked that question, because it was an anonymous question, has a strong GPA or whatever. Like, you're actually not looking at it macroscopically fairly. Like, and that's not a little change. That's saying rather than cancel the GAMSAT, we're just going to take this opportunity to entirely restructure that's anarchic.
Okay, I can answer this one. How long does it take to become a fully qualified surgeon? So it depends on what kind of surgeon.
Sure.
If you want to do specialty surgery, in a fucking long time. So I'm interested in doing cardiothoracics, and I passed the GCSE. I've done like all of these exams, and I still don't have a clear pathway, and it's only going to get worse. General surgery, I don't know. Let's say 10 to 20 years. That's probably from starting med school. Yeah.
How much change do you think we need for them to not cancel the GAMSAT?
As in, so like on the current rate of cases, so I think we'll need to see case volume flatten out a little bit, hopefully.
Or again, the models could predict flattening.
Yeah.
There is evidence suggesting GAMSAT is not a good predictor of performance. There was a paper published by, I think it's worth saying, a bunch of medical schools that are massive fans of the GAMSAT. There's also plenty, and I mean heaps of literature saying that the GAMSAT is actually a really good predictor. So, and not only of that, of how you will handle later years of medical school. So,
I guess it's one of those things, right? So like, I'm sure, like maybe it's nothing in isolation is perfect. But then like, what do we propose is better? Because GPA and interviews without the GAMSAT is certainly not better.
GPA isn't a good predictor.
It's certainly not good, Will some unis refuse to accept lower scores? It's possible, I think it's possible. I think but they might just change the way. That's an unknown. It's possible,
Do you think lower applicants compromises the integrity? Do you think they'll fill quotas to the minimum bar scores? I think there's actually quite a lot of people with like scores above 60, and also we need to realize there's some unis that will happily take people from different sub-quotas that have got different scores. So not really. I don't think it compromises integrity. It's a rock and a hard place situation. So
and we're not saying the scores would suddenly become, like anyone can get in. It's still going to be students that have done well, just maybe not as well as previous.
This is a great question to finish on.
So do I keep studying for the GAMSAT?
Yeah, so for this week, no. Put the books down, put the pens down, put down whatever you were doing, even if it's phrases, material. It's not of any use right now. So just chill, try to take stock of things, and wait for March 23rd. It's not that far for that to come.
And we'll definitely be scheduling more of these chats like as the developments unveil themselves. I guess my general feeling is, for those that, maybe like who actually ever feels good about their preparation in general, everyone feels unprepared. Even some of our students have been studying for months, feel like they need more time. You've been given more time. Everyone is equally disadvantaged in this. No one is getting the opportunity to sit. So take it as an opportunity to, one, recharge, two, fix other things in your life, like we said. And then ultimately, like, you have more time to focus on problem areas.
So you can find the score machine on the Phrases interview website.
Click the free.
Callista, this is not a silly question, but I can explain this perfectly for you. So GPA is not a good indicator because the way you are tested across different subjects at uni is very, very different. Secondly, one thing that they don't necessarily test for, and you can make a really strong case that they actually almost completely don't test for, is aptitude. So the types of skills you want in a problem-solving type profession like the health sciences and like being a doctor are not tested through memorization of chemical compounds, functional groups, and that type of thing. So you can have a great GPA, and we know this is a fact. People with 7 GPA go in and just bomb the GAMSAT because they don't actually possess problem-solving skills. All they possess is a fantastic memory. And being a doctor isn't about how well you memorize things. So equally, you can have someone with a very average GPA, but happens to be really perceptive, really good at taking information and synthesizing it, things that are very high in Bloom's taxonomy of
Yeah.
what is an indicator of intelligence, because memorization is not an indicator of intelligence. And they would be unfairly selected against with their GPA, when in actual fact, they're the people that we want.
Yeah.
So really comes back to the test, and the GAMSAT is seen as a very well curated test. And a lot of our uni tests, sadly, are very poorly curated
and I
tests.
can speak to that. Like when I was going through uni, I did a lot of maths, and those subjects are almost impossible to pass. Like the failure rate is so high. And I had a couple of subjects where I was getting, credits and distinctions, and like I would be an example of a student who would have been disadvantaged by a pure GPA calculation, where biomed, human structure and anatomy is super easy to get high distinctions in. So like, I guess in general, GPA is not a good measure.
Yeah.
How could I
build my portfolio around self-class strategy? So firstly, if you're only starting your portfolio building now, that's probably an indicator that you're not going to be competitive.
What a question. I'm so sorry for
portfolios. Yeah. Portfolios are about track record. It's not about a bunch of awards that you've won. It's not about just starting now.
Yeah.
You need to show that you are a person that fits these types of values that these universities are looking for. This should have been evident since some time ago.
Years, yeah.
Getting a volunteer job at the Teddy Bear Hospital starting today, pretty obvious that you're only doing this for the
But
portfolio.
assuming you are like first year, or you're looking at this in a 2 or 3 year horizon,
yes.
there are still things you can do so that hospitals will still be looking for volunteers. There will still be opportunities within this self-isolation scheme. So I would still be taking those up as long as you're happy with the risks.
The other thing is a lot of people really don't understand portfolios. They think it's about school captaincy. They look at Notre Dame and say it's about who's the biggest Christian. Actually, it's really, really not. And a lot of you guys who are doing things don't actually realize there's a lot of things that translate to those different criteria that they're looking at.
Yeah.
So it's the same as a really good job application. There's selection criteria, you've got to meet them, and oftentimes there's really unique ways you can do that, and you didn't realize that you could. And the unique ways stand out.
And a lot of it as well is about the way you describe what you've done. So obviously, there is a minimum bar of experience and things that you need to have done for you to write about something meaningfully. But if you have a few things in each category, like that's why we spend so much time helping people with their portfolios, because there is a correct way to write about those experiences and an incorrect way. Kind of pandering to getting in and why this makes me a good doctor is often the incorrect path. Talking about those experiences and the qualities and attributes you acquired through them is usually the better route. I guess working on your portfolio and the experiences is important.
Yeah.
All right. What time is it? How are we tracking?
Kind of things I look for in the portfolio. A range of different things. To be honest, I think maybe like the phrases GAMSAT and the phrases interview page, when we do our portfolio workshops, we cover this in depth.
Yeah. There's actually, if you Google the ultimate applications guide for GAMSAT, we have like a super huge page and we talk about each of the things that Notre Dame looked for last year and the University of Wollongong, and we'll update them going into this year once all of these changes happen and we understand how applications are changing. My experiences haven't been associated with medicine at all.
Would that be a disadvantage? No.
Usually not, actually. It's often an advantage, I would say.
Yeah, well-rounded.
Things like community experience, and it's good to do things that are non-medical.
How did you create your interview calculator? How accurate is it?
So interview calculator, part of the way that we tutor people in the interview space is we want to understand what student scores are, obviously anonymously, but we want to understand where they sit so we can self-assess how well our training works. If students are barely getting their interview offer, that changes how we self-assess how we did, versus if students have had really high scores and then were unsuccessful, which is rare. So basically, we thankfully, due to our numbers, we had almost a quarter of the cohort that applied that had interviews last year, went through our programs, and we had their GAMSAT GPA, the offer that they had, which school. So that's how we basically did backwards math to create a calculator that works out based on GAMSAT and GPA, which schools and how likely you are to have an offer. So in general, from our data, it's actually extremely accurate. So there's this thing called an S-curve. So our confidence interval, the more confident we are, the more steep the decline. And you'll notice on the calculator, if you move GPA 0.01 or 0.02, you'll go from 0% chance to 100% chance. So our confidence is actually very high. the confidence is a little bit lower on the portfolio universities because we're basing it off how we assessed portfolios. So we had students who we helped with their Notre Dame and Wollongong portfolios, and we scored them. So we've added that into the calculator, but obviously the way we score portfolios may or may not be well associated with the way the universities score them. So basically, the bottom line is it's pretty good. Use it, play around with it.
Yeah. So in the case they decide to reschedule June be the earliest they'd set it, I'd say yes, because they also want to try to allow time for this to pass. One previous year when they did an offer of a reset in Perth, they only gave 2 weeks notice, but that's different. It was a reset.
Yeah.
It was because of a mistake.
They're trying to contain the information.
Yeah, and to be honest, it wasn't much of a mistake. It was actually the students really complaining. So that's why I think they said like 2 weeks. And then they also said, but you'll never find out your GAMSAT score from the one that you had. So you have to forego that. And like 3 students took up the opportunity to do the reset, which tells you about the level of inconvenience.
What's the discrepancy between the number of candidates that are interviewed versus the number of places that are offered? So the truth is that no one exactly knows because the universities don't always publicize both the number of offers they give out and the number of places that are given. Our internal feeling about that is roughly speaking 2 to 1, but it depends a lot on the universities. Some interview less, some interview more.
Yeah. Do we need interview training?
I would say yes.
Yeah.
So I can't tell you how many students we've seen in our interview training programs that have come in at a certain level and really sort of exponentially improved by the end. Obviously we're biased, we do interview training. So, I mean, what else are we going to say? But the thing that is made me feel like it's more and more needed is because more and more people are doing interview training. So like I said, this is a fact. We had a quarter of the total pool of students doing our interview programs. So do you want to be one of the students that's not doing the interview programs versus the students that are doing the interview programs? I mean, we have years and years of questions that have been done at those universities. It's just such an advantage. It is what it is. And unfortunately, it is becoming something that is not required, but encouraged.
The other thing is there's an element of maturity that a lot of students don't possess. And so there's this assumption that, I'm a top bloke. I'm a top chick.
Yeah, I'm cool.
I'm cool. But the questions aren't asking that. They're often asking for sort of underlying principles like empathy and whatnot that you need to be able to display. A lot of students don't understand the medical framework, so they fall for tricks in questions that are obvious to people that understand medical ethics.
And it's always super clear. Like there are heaps of people that were like very engaging, lovely to go have a coffee with, but then given a challenging question, don't do a good job.
Yep.
And you get that sense, like when you're in the room, you know they're nice, but they haven't given you enough for you to score them well. But there's both sides, right? There's also people who are way too robotic, and that's part of our coaching is to just get the best of both worlds.
Interview training categorically is not about prepared answers.
No, not at all.
I can tell as an interviewer if you're preparing this, therefore you are showing a lack of integrity just by doing that.
Yeah.
So it's not about going in there with a script. It's actually about understanding and being able to show your depth of thought, depth of analysis, that type of thing.
Okay, is the why medicine part of the ND portfolio worth as much as the experience descriptions? The bottom line is no one knows. So my feeling is that the Notre Dame assessment is a holistic assessment.
Yep.
It's probably not, there's a certain number of marks for each category, despite maybe what they tell you on the website, because we've had students who, for varying reasons, like have similar applications, or we think they're roughly equivalent, and one gets in, one doesn't, and they call the uni and they don't really have a reason why. I wouldn't be surprised if University of Notre Dame are putting faces on the wall, putting together their portfolio, the interview performance, correlating these things and really curating their cohort. So trying to be objective about, how much time should I focus on this or that, it doesn't really make sense.
Yeah. Even the 100% of unis numbers.
So no. So they're just there. The listing is not in any particular order. Sorry, this is the preference machine for everyone that's wondering what we're talking about. The universities are listed from 1 to 11 or 12, I think. It's not in any particular order.
So you should start your interview training post GAMSAT. With that said, if they reschedule, we're going to be having another webinar after the announcement, whenever the announcement is, We assume the 23rd, but apparently now
Yeah.
going to be later. And that does change timelines for things, and there's definitely ways students should sort of balance that. So we'll kind of cover that then.
And I guess one small plug is that there's a complete money back offer with all of our interview training. So if you want to start with us super early and don't get an interview offer, you get your money back.
Yeah. How long between the interviews actually doing it? Getting shorter and shorter.
So University of Sydney, I'm 100% sure are looking at when we're running our training, because last year they had a timeline, then we published our dates, and then their timeline changed.
Yeah.
Maybe I'm being too paranoid, but I think that's actually the case. And they're changing the window to be tighter and tighter. That's why we introduced our guarantees, so that you can start super early, and then if you don't get an offer, you get your money back.
So this is a good question. If it gets rescheduled, can we join a course, or we'll be doing an alternate course? Yes, we're going to work out something at least for the interim if there's a reschedule.
Yeah.
But we're not going to announce any of that until we really know what's going on.
Yeah.
And until there is, we don't really want to say what we want to do, because we want to make sure that it suits the timeline or what have you.
Yeah, and has the flexibility for unforeseeable events.
The things we can do right now to start preparing for interviews.
I think it's a little too early, so
sure.
I would still focus on GAMSAT for now. If you have a really good GAMSAT score, check out our Fraser's interview website. You can sign up to our free course and have a play around.
Do your programs have flexible payment plans? Not only do they, we were the first to do that, and I think everyone followed us. Maybe this is the first year they tried. But we've always done payment plans.
I think we have 20 or 30 week payment plans. So, it's $20 or $30 for a massive sort of timeline. We're super flexible about payment plans with students. Yeah.
Cool.
Always have been.
You should not start pulling or building it too late. How much time from applications should you start roughly?
It depends. So it depends how much time, I could sit down and write a whole portfolio in one night, but how long is a piece of string? It's up to you.
Yeah.
I would say start collating your experiences, see what you have, and maybe identify gaps and those kinds of things. It's worth plotting that out at least a couple of weeks before you have to apply.
Yeah. Start tuning this year if I have a GAMSAT of 65.
I would say yes.
Yeah, it's a good score.
Yeah, that's definitely, again, depends, right? So if it's cancelled, definitely yes. Super yes. If it's not cancelled, obviously depends on your GPA and a bunch of other things, but 60 students with 65 is definitely good offers.
Cool. Awesome.
Any other questions, everyone? Before we escape forever.
Yeah, look, if not, thanks everyone for jumping on. As we said, when the announcement's made, we'll have a follow-up webinar to let everyone know what we think you can do going forward. So stay in touch, and thanks for dialing in today.
Couple last questions. If rescheduled, should we change our study plans? I used all the ACE materials. So I'm assuming, so you maybe only had the ACE materials that you were preparing with. Yeah, definitely. So I would definitely look at, obviously our leaning is our resources, but definitely change your study plans based on the dates that are announced. Providing the GAMSAT is meant to select suited applicants, do you think anyone with the right prep can do well? Yes. Yeah.
Literally.
Definitely. Yeah.
Anyone, doesn't matter what your academic background is, doesn't matter your age.
Yeah, everyone can do well.
Yeah.
Cool. All right, everyone. Well, thanks so much for coming along, both on Zoom and also on Facebook Live.
Yep.
We'll be posting announcements and other things as they come through. So I guess watch this space, and if you have any questions, don't hesitate to email either myself or Scott with any of your questions.
Tom@frasersgamsat.com.au, Scott with double T. frasersgamsat.com.au. And
should be pretty much it. So thanks so much, everyone. Bye. Last questions are,
thank you.
What do you think of that GPA 6.9 and Melbourne 66 is very good, especially with the cancellation. Okay, bye everyone.
Really well.